Now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIVU network, 99.7 FM, 1600 AM. Here's Omega Jones.
And thank you so much, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Well, before we went on break, we were in the middle of an interesting discussion with Dr. Sandra Carr Johnson. We're talking to her about respiratory illnesses. And before we let her go, we want to talk to her about the danger signs you should look for that say you should go to the emergency room or you should go to urgent care.
So this is really important, and it has to do with the severity of symptoms. When there's a mild course of flu, COVID, RSV, you'll have the coughing and the sneezing and the stuffiness of the nose, sore throat, headache, chills, fatigue, low-grade fever. And this should resolve within 7 days, I could say 10 days. Mm-hmm. But when we're talking about rapid onset of a severe cough, not being able to breathe, wheezing, some people this can hit them across a day and go from mild to severe in a short period of time. And that, even if it's the flu, means that this might be that deadly variant that we're talking about, and that means immediate help outside of the home. Urgent care, if the patient's able to talk, if they're not able to talk, that's a sign of severity for 911.
Dr. Carr Johnson, let's talk about pneumonia.
Okay.
Why is pneumonia often worse or more dangerous than the other illnesses?
Mm-hmm. So when I was talking earlier about pneumonia being in that lower respiratory condition, lower, meaning in the lungs, below the vocal cords, and more dangerous because pneumonia is fluid building up in the air sacs of the lung. And that fluid building up in the air sacs can cause a block of the oxygen that needs to be there, leading to severe breathing difficulties, potential organ failure, and in severe cases, respiratory failure, which is lung failure. And vulnerable populations like young children, older adults, those with weakened immune systems are more at risk for that, can lead to sepsis, which is a bloodstream infection, very deadly. So we want to avoid pneumonia. And though we haven't talked as much about the pneumonia vaccine, that's also an important consideration.
All right. Well, briefly tell us about the pneumonia vaccine.
Okay. So children and older adults, so 50 and up for adults, under 5 for children, but folks who have certain conditions can get it outside of those ranges. And there are like different strains of the flu, there are different strains of pneumonia, and this vaccine helps prevent bacterial pneumonia. And the bacterial pneumonia can be very deadly. And as I mentioned, the blocking of the oxygenation. So we want to avoid that, and the vaccines help that.
Now, Doctors Carr Johnson, before we close out your section of the interview, is there anything that you want our listeners to know? Is there anything that you want to stress about respiratory illnesses, respiratory illness season, or the particular illnesses themselves?
Absolutely. So thank you for the opportunity again. And the keys are the 3 W's. Wear the mask over the nose and mouth, wait in line 6 feet away, and wash hands often to stay safe out there. And reach out for help when needed, and Cape Fear Valley is here to help.
Ladies and gentlemen, Dr. Sandra Carr Johnson. She is the Chief Medical Officer of the Cape Fear Valley Medical Group. Dr. Carr Johnson, thank you so much for coming on the broadcast today.
Thank you for having me, Omega.
All right, ladies and gentlemen, up next, January is National Birth Defects Awareness Month. So we have we have with us today Dr. David Schutzer. He is the medical director for the Cape Fear Valley Health System's OB/GYN clinics, and he's here to discuss National Birth Defects Awareness Month. Welcome to the broadcast, sir.
Great. Thank you for having me. It's great to be here.
Now, Dr. Schutzer, on their website, the Center for Disease Control, they make a point to say that language matters. Now, while birth defects is a medical term, it doesn't mean that a person is defective. Now, the medical term, it does refer to the health conditions that the baby develops before birth. But I guess the question that I have right now, Dr. Schutzer, is when a parent hears the word, your baby has a birth defect, that doesn't mean that the baby is defective, correct?
That's exactly correct, Omega. I think starting the conversation by acknowledging the language and its potential impact is a very good approach. The term birth defect can unintentionally carry negative connotations or imply judgment. So we want to use specific names for conditions because this helps to avoid the stigmatization and also promotes a more empathetic and informed conversation. Birth defects are structural changes that can occur before birth and can affect any part of the body. Some affect how the body looks, some affects how the body functions, and others affect both.
Considering all of the varieties of conditions, how common are birth defects?
I think most people are surprised to know that 1 out of every 33 babies is born with a birth defect.
Really?
Yes.
Now, are there some things that parents can that can increase a parent's risk of a child for a child to be born with one of these conditions?
Yes. So not everything is known about birth defects, but most known risk factors can be modified. So for example, medical conditions such as hypertension, diabetes, and obesity, they can increase your risk of having a baby with a birth defect. So keeping those conditions under really good control with a healthy, balanced diet, regular exercise, those are critical. Other things such as smoking, including marijuana, recreational drugs, alcohol use, all increase the risk of birth defects. Certain prescription medications, such as isotretinoin, which is used commonly for acne, also may increase the risk of birth defects. And then there are some risk factors that are not modifiable, such as a family history of genetic conditions.
Let's talk about testing. What if more testing showed something that is, let's say, somewhat repairable, but is going to require more care, or let me rephrase that. Let's say we have a birth defect that is repairable. Is it going to require more care before or after birth?
So if a birth defect is suspected, then the first thing is to have a conversation about what that birth defect, that suspected defect is. Some of those families undergo additional testing. There's a specialist called a maternal fetal medicine specialist that a family may get referred to, and that doctor may recommend additional ultrasounds or more diagnostic testing. Some conditions that we suspect might be present are found not to be present. But in the case where there is a condition that's found, depending on the type of condition and the severity, The maternal fetal medicine specialist will come up with a plan of care for that individual patient. Now, some birth defects we know are going to need additional care after delivery. So sometimes families might be sent to another specialist, such as a pediatric surgeon or a pediatric cardiologist, who will come up with a plan of care for that pregnancy.
Now, you mentioned pregnancy. Pregnant women, I know for a fact, Dr. Schutzer, they get all kinds of advice. They get all kinds of words of wisdom. It's to the point to where it makes their head spin. But what about father-specific advice? Do you have any father-specific advice that you would give?
Yes. So for fathers, we recommend that, number one, they also maximize their health. So good balanced diet, try to avoid processed foods, limit alcohol consumption. Good exercise habits has been found to improve sperm quality and motility. And then keep your regular checkups, because some folks may have an underlying condition that if we can maximize that condition, we can limit the impact that it has on the pregnancy. Additionally, if there's a family history of a genetic issue, the couple can be sent to a genetic counselor to have that type of counseling. And then finally, men should support a healthy habit for their partners.
If both parents are completely healthy, can they still find themselves hearing those dreadful words?
Yes, it's not common, but unfortunately, most birth defects have no known cause.
Let's talk about technology, Dr. Schutzer. It's made so many wonderful advances, especially in the areas of prenatal care. Are most defects detected now before birth or during birth?
So most defects are actually detected within the first year of life. Some defects may not become apparent until later in life, such as heart defects.
Yeah.
We've come a long way, though, in prenatal testing and ultrasounds, and we're very fortunate in this community to have a maternal fetal medicine specialist who can aid in diagnosing birth defects and coming up with a specialized care plan for that individual pregnancy.
You mentioned birth defects and heart defects. I'm one of those people that you're looking at, Dr. Schutzer. I wasn't born with a circumflex artery. And I'm looking at the doctors, and all of them were like, what? But so you did mention birth defects, and I did not find out that I was not born with a circumflex artery until I got into my 50s. So this is common for folks not to know that they have a birth defect, like maybe I found out 50 years after I was born.
That's true, Omega. Fortunately, most of the actual birth defects that we see are very minor cosmetic type things, such as an extra digit or even an extra tag on the ear, which is counted as a birth defect.
Okay. Ladies and gentlemen, in the studio, Dr. David Schutzer. He is here to talk about birth defects, and January is National Birth Defects Awareness Month. So that's the reason why we're here today. Now, what is the earliest that most women should start their prenatal care?
Sure, great question. That comes up all the time. Your first prenatal care appointment typically should occur between the 6th and the 10th week of pregnancy, but that varies depending on an individual's history or any current concerns that they may have. Women, for example, who've had a history of an ectopic or tubal pregnancy, they need to establish care as soon as they suspect that they're pregnant. But in general, between 6 and 10 weeks. Sometimes your first visit may be with a nurse who's going to review your medical history, your family history, and your medications. They may start prenatal vitamins if you're not already taking that. And then all concerns should be discussed as they occur. So most physicians will have a way to contact them if a concern arises. There is also some great websites. The best one, in my opinion, is the American College of Obstetricians and Gynecologists. They have some great patient education on their websites, not just with birth defects, but all parts of pregnancy, and that patient education is very easy to understand and accessible.
Let's say there's something that parents are concerned about, Dr. Schutzer. How soon should they bring that up to their obstetrician?
Well, I think there are lots of concerns that occur during a pregnancy, and certainly if you have a great concern about an issue, that should be brought up right away. So even if that involves a phone call, some offices, you can message them over an electronic health record, but never wait. If you have a concern, always reach out. That's what we're here for.
Ladies and gentlemen, Dr. David Schutzer, he is here to discuss birth defects during National Birth Defects Awareness Month. Dr. Schutzer, could you give us an outline of what a family might expect if a scan shows something or a blood test shows something?
Sure. So the first thing to understand is that just because a test may show something doesn't mean that something is wrong. So there's no test out there that's perfect. The first step would be to discuss that test result with your obstetrician, and they can provide some education on what that test is. Depending on what the specific abnormality is, they may refer you to the maternal fetal medicine specialist, as we mentioned before. And the maternal fetal medicine specialist may do an even more detailed ultrasound or additional testing on the pregnancy. And then once all that information is available, then they'll come up with a detailed care plan for that pregnancy.
Let's talk about information and support. The internet makes it easy, and with the internet making so much information available, what support groups are out there for parents who find themselves in this situation, or are there support groups that are available?
Yes, so locally, or statewide at least, North Carolina does a great job. There's something called the Family Support Network of North Carolina, which provides support for families with special needs children, including those with birth defects. Another great resource would be the March of Dimes website.
Now, finally, Dr. Schutzer, is there anything that you want to share with our listeners, our viewers, or something you want to stress regarding Birth Defect Awareness Month, birth defects themselves, or pregnancy, to make sure that this doesn't happen to parents?
Sure. As I said, most birth defects don't have a known cause. But probably the most important thing, if I had to stress it to parents or prospective parents, is to take their health very seriously. Make sure you eat a balanced diet, exercise, make sure you're going in for your preventative appointments. To piggyback on what Dr. Carr Johnson had said earlier, there are some infections such as the chickenpox virus or measles, so keep your immunizations up to date. That can reduce the risk of birth defects. And you should see an obstetrician before you get pregnant, and the obstetrician can then kind of guide you through your getting pregnant, some steps you can take ahead of time, such as folic acid. Folic acid is important to avoid certain birth defects called neural tube defects. And these are defects such as spina bifida that can have really serious impact on the health of a child. And just it's important to plan. An ounce of prevention is worth a pound of cure.
And one other question, Dr. Schutzer, that just came to my mind. Women who are older and get pregnant. I've always heard that older pregnancies have higher risk for birth defects. Is that true?
That's actually true. There's a higher risk for chromosomal abnormalities. And remember, you're born with all of the eggs you're ever going to have for your entire life. And we tell women that the really vibrant eggs are released when you're young, and you may not be ready to get pregnant then and delay pregnancy. So more common to have chromosomal abnormalities, and just the wear and tear of life, diabetes, hypertension. All of us, me included, have the little bit of weight to shed. So yes, that is true.
All right. Well, ladies and gentlemen, Dr. David Schutzer, he is from Cape Fear Valley Health's OBGYN clinics. And Dr. Schutzer, thank you so much for being on the broadcast today and educating us on birth defects and National Birth Defects Awareness Month. Thank you so much.
Thank you so much for having me.
Well, ladies and gentlemen, this wraps up another edition of Cape Fear Valley Health's Making Rounds Live. Please join me in thanking our guests today. First, we had Dr. Sandra Carr Johnson with us. She is the Chief Medical Officer for the Cape Fear Valley Medical Group. And we had Dr. David Schutzer with us today from Cape Fear Valley Health's OBGYN clinics. Now, our next broadcast, ladies and gentlemen, is Tuesday, January 28th, when we will have Cape Fear Valley CEO, Mr. Mike Nagalski, with us. We're going to talk about the health system's highlights from last year's and what he's looking forward to for the upcoming year. So make sure you join us. Mark the date, Tuesday, January 28th. So from our producers, Shaka Jordan, Ray Thomas, and Lindsey Graham, and the hardworking team behind the scenes, I'm Omega Jones, continuing the legacy of Darvin Jones. Thanks for listening and watching Cape Fear Valley Health's Making Rounds Live.